The DD Form 1380 Tactical Combat Casualty Care, or TC3 card, is the approved method for documentation of pre-hospital combat casualty care. It is used for communicating the details of casualty injuries and treatment information from the point of injury throughout the continuum of care, ensuring the casualty receives the best care possible, as it is the first and sometimes the only record detailing the pre-hospital treatment given to combat casualties. Accurate and thorough documentation is of the utmost importance. The card also becomes part of the permanent medical record for the service member. In addition to supporting treatment for acute injuries, the information also serves as documentation for later in the service member's military or post-military career, assisting with management of ongoing health concerns and supporting disability evaluations. Additionally, the de-identified information from the DD1380 becomes part of the Joint Trauma Registry, which informs evidence-based combat casualty care process improvement and identification of best practices. This has led to advances in tactical combat casualty care and contributed to better clinical outcomes. The DD1380 form is fairly self-explanatory, but it is important to become familiar with the form's elements and uses before you deploy and need to fill one out yourself in a stressful tactical situation. The TC3 card should be completed by whoever is providing casualty care. If a combat lifesaver is available to help, you may have them assist in documenting casualty information while you continue to treat casualties. You should use the casualty's TC3 card found in their joint first aid kit. Fill it out with a pen or marker, understanding that if a section asks for information you do not have, you should leave that area blank. A best practice is for units to ensure individuals fill out the demographic information on the TC3 card prior to deployment. But if that has not been done, or you are not using the casualty's card, you may need to fill out that information. On the top of the front page, the first entry is for the casualty's battle roster number. Battle roster numbers are usually dictated by unit-specific policy. Otherwise, the battle roster number should be annotated using the casualty's first and last initial, followed by the last 4 digits of their Social Security or ID number found on their ID tags. For example, John Doe 123121234 is battle roster JD1234. Based on your assessment of the casualty's status and in coordination with the casualty evacuation team, assign each casualty an evacuation priority and mark with an X on the casualty's 1380 as urgent, priority, or routine. The demographics section includes the casualty's name, last 4 of their Social Security number, their gender, their branch of service, their unit, and their allergies, if any. Additionally, date and time of injury are documented in this section by whoever is documenting the casualty care. As mentioned before, it is a best practice for service members to fill out information on their own DD Form 1380 in their joint first aid kit prior to deployment. If not previously filled out, it may be necessary to get this information from the casualty. If the casualty is unable to respond or is confused, obtain the information from their ID or dog tags or other unit members. The following section is the mechanism of injury, the M of a MIST report. You may need to annotate more than one injury. Most of the definitions and acronyms are self-explanatory, but they include artillery, blunt injury, burn, fall, grenade, gunshot wound, improvised explosive device, landmine, motor vehicle crash or collision, rocket-propelled grenade, or other, where you would need to write in a description. The next section is for injury, the I in a MIST report. This is where you identify the site of any injury on the anterior and/or posterior body diagrams by marking it with an X. For burn injuries, you would also circle the burn percentage on the figure. If there are multiple mechanisms of injury and multiple injuries, draw a line between the mechanism of injury and the site of the injury. If a tourniquet was applied, annotate which extremity it was applied to and when it was applied, as well as what type of tourniquet was used. After that, the last section on the front page is for signs and symptoms, the S in a MIST report. This is where you would document vital signs and pulse oximetry readings and the time each was assessed. Additionally, there is a place to annotate the casualty's responsiveness using the AVPU scale and a 0 to 10 pain scale assessment. When you turn the card over, the top section repeats the information on the battle roster number and the evacuation priority. The top section is for treatments, the T in the MIST report. The top line, or first C, is for hemorrhage control interventions that help with bleeding, such as tourniquets and their location, extremities, junctional, or truncal, any wounds that were packed and dressed, and the type of intervention, cat tourniquet, combat gauze, etc. The next line, or A, is for airway assessment and interventions. If the airway was not intact, document the intervention and device type used to open it. NPA means nasopharyngeal airway. Cric denotes cricothyroidotomy. ET is an endotracheal tube, and SGA is a supraglottic airway. The following line, the B, is for treatments that help maintain breathing or respirations, and if applicable, document any interventions and the devices used. This would include O2, oxygen administration, needle D, needle decompression of the chest tube placement, and chest seal application. And the next line, the second C, is for circulation, where you document the type, volume, route, and time of any fluids or blood products given. The medication section, Med, is for documenting any medications administered and should include the name, dose, route, and time of any analgesics, antibiotics, or other medications. The one exception is self-administration of the combat wound medication package, which is done in the next section. At the bottom of the fluid and medication section, in the Other section, you can document administration of the combat pill pack, placement of an eye shield, and which eye, splinting of a fracture, active and passive hypothermia prevention measures, with the type of device used, or any other treatment rendered. The next section, Notes, is open to record any other pertinent information and/or clarifications that you think might be important for the next casualty care team. The last section, First Responder, at the bottom of the page, is where you would document the name and last four of the Social Security or ID number of the first responder providing casualty care. Be sure to securely attach the TC3 card to the casualty in accordance with the unit's standard operating procedure. Appropriate places for attachment include the casualty's belt loop, their left upper sleeve, or their left trouser pocket, based on the casualty's injuries and clothing. Alternatively, the TC3 card can be handed off to the next provider in the continuum of care. Also, if more space is needed for documentation, you can attach another DD Form 1380 to the original using a safety pin or some other means. The form should be marked accordingly on the top right-hand corners with 1 of 2 and 2 of 2, making sure the second card also includes the casualty's name and unit.